Hello and welcome to Arirang TV's special coverage of the COVID-19 pandemic. The leaders of the G20 are gathering today for an extraordinary virtual summit to work out a coordinated response to the COVID-19 crisis as it initially proposed by President Moon Jae-in. So today we'll go in depth on the global efforts to fight the outbreak. But first we have Kwon Soa and Noah Ram with us with the latest on COVID-19. We'll start with you, Soa, as usual. I understand the cases of imported infections is on the rise.
That's correct. 57, in fact, out of 104 new infections that were confirmed today were cases from abroad, with 30 of those detected through the measures being enforced at airports for people arriving in Korea. So let's take a look at the details. As I said, 104 new cases, and that's a total of 9,241 now. And we have 5 more additional deaths, bringing the death toll to 131. Now, what's notable is that the number of people in quarantine for COVID-19 has dropped to below 5,000, and the number of patients fully recovered from the virus has exceeded 4,000. So both in their 4,000s, meaning the gap is narrowing. Now, apart from the 57 imported cases, we have 26 and 12 new cases in Daegu and North Gyeongsang-buk-do province, respectively, and the metropolitan area, which includes Seoul, Gyeonggi-do province, and Incheon, saw a rise by 28 cases combined. Now, while the number of daily cases has not dramatically changed, it's 4 more than yesterday. Authorities are stressing every time that it's not time to relax.
And of course, today was not an exception.
Exactly. In fact, the Korea Centers for Disease Control and Prevention called on people to really abide by the existing social distancing measures. Today, putting an emphasis on not sending students to private academies before the delayed school semester begins in April. And this as some parents have begun to send their kids to such academies. The KCDC also urged the nation's people to cancel gatherings in enclosed spaces. Authorities are also continuing with their inspection around the country at places that are vulnerable to these infections, which includes, for example, these singing rooms, for instance, or PC rooms here in Korea. And those social distancing measures that were initiated a little less than a week ago are being now enforced for some 5 days. Now, the authorities are also inspecting some 50,000 businesses that I just mentioned. Meanwhile, with more and more passengers having to be tested for the virus upon arrival, new walk-through testing facilities are going to be launched at Incheon International Airport today. And authorities say they are installing them outdoors to make disinfection processes much easier. And the new facilities will make it possible to test 12 people an hour, while other facilities only could test like 1 or 2 people an hour. So that does make a big difference, and they will operate 16 of these facilities, 8 at Terminal 1 at Incheon International Airport and 8 at Terminal 2. So that means some 2,000 people can be tested in a day.
Oh, I see. That would definitely make it easier for the medical staff there. And of course, we have stronger checks that's coming up for people arriving from the U.S. Speaking of the U.S., numbers there are rising.
Right. So for the global updates, let's take a look at our table here. Of course, China still has the largest number of infections at over 81,000. But that may change soon, because in Italy, we're seeing a total number of cases at 74,000, more than 74,000. And then the U.S., more than 65,000 cases are surging there due to the ramping up of testing in that country. Germany, meanwhile, compared to the total number of cases that's at over 37,000, the death toll is significantly lower than in other European countries. Meanwhile, in Iran, the death toll now exceeds 2,000, and Switzerland's death toll surpasses 100. In the UK, there are more than 9,500 cases, but according to a recent study, half of the people in the UK may already be infected by the virus. That has not been confirmed yet, but such case is coming out.
That is a very grim outlook. Meanwhile, leaders of the group of 20 major economies will convene a video conference, as I mentioned earlier on Thursday to discuss possible ways to fight the COVID-19 pandemic. What can we expect then?
Well, South Korean President Moon Jae-in will be taking part in that, and he'll use the conference to share Korea's know-how about the countermeasures that it has undertaken to fight the outbreak, as well as the policies to limit the economic fallout as well. And Korea has been getting the spotlight for its, shall we say, large-scale, widespread and speedy tests throughout the global media and through international community as well. And Moon also plans to suggest a travel ban waiver for business people with an official document showing that they are negative for the virus. And the measure is aimed at maintaining cross-border business-related activities. And the Blue House said that G20 members would adopt a joint declaration at the meeting, and it expects Moon's proposal to be included. As well as the G20 members, the UN and the WHO are also joining the meeting, along with some other international organizations. Saudi Arabia's King Salman will be chairing the session as the country holds the G20 presidency this year. And the G20 Leaders Conference actually follows a separate conference of the finance ministers and central bank chiefs of the G20 nations. And in that discussion, they agreed to develop an action plan to help with the fallout, economic fallout of the COVID-19 outbreak.
Adam, social distancing, it's a big word now, and officials here are saying that social distancing can actually have better than expected results. Yeah,
that's right. And Korean health authorities say that social distancing is more effective than what is known as herd immunity. Now, what this herd immunity is when an infection is no longer prevalent because a vast majority of the population have been infected already, so they have built an immunity. Another way that people build immunity is through vaccines as well. So that means that this virus will have no longer many hosts to invade, if you will, and so that's why the spread of it will in the long term die down. But because COVID-19 as of yet is a still mysterious virus at the moment, and so there is no vaccine, the only way to build immunity is through actually contracting the virus, which obviously is not the best option at the moment, as we've seen the numbers, the deaths and the cases so far. So that's why the Korean authorities are emphasizing that social distancing is the best option at the moment. They say this is in order to prevent contraction in the first place, and therefore that is the best way to fight the virus. Obviously, other countries are also urging social distancing as well, but although the numbers are still spiking, without social distancing, they will spike even further.
There's been a theory that the COVID-19 outbreak may kind of subside when the temperatures get warmer. I understand this is not the case, though.
Apparently not. The EU, actually, the European Centre for Disease Control, or the ECDC, says the summer heat is unlikely to stop the spread of coronavirus, unfortunately. The ECD cited research suggesting that the virus does not become less dangerous in hot and humid conditions. We know in Korea we have very hot and humid summers, but apparently that won't be enough to fight the virus in the summer season. And obviously this has dampened the hopes of particularly countries in the northern hemisphere that could get a respite when the summer arrives. Preliminary analysis from the outbreak in China found the virus was able to maintain high levels of reproduction in tropical areas such as Guangxi and Singapore. And the ECDC therefore has stressed the importance of implementing intervention measures such as self-isolation and the other measures that we have mentioned earlier. And the agency also noted that healthcare systems in Europe face a high risk of oversaturation, as sick beds will become less available somewhere between mid-April, Europe is saying. So they will be swamped with patients by then, and that's why they need to boost capacity and reduce the spread of the disease. And in terms of the survivability of the virus itself, the ECDC has some interesting numbers. They say that the COVID-19 can survive 3 hours in the air, up to 4 hours on copper, which is one metal that was considered as a way of preventing the spread of the virus, but it does survive 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel, although it will significantly decrease in power and infection.
Hopefully it will. Up next, first, thank you. Arirang and Noah. Up next, we take you to the Central Disaster and Safety Countermeasure Headquarters for the regular briefing on the COVID-19 COVID-19 situation in Korea. As we learned from our Kwon-soa, the number of newly confirmed cases stands at 9,241, having risen by over 100, with more than 50 of them coming from outside of Korea. Right? That was the numbers we were given to us earlier on. That's why they've asked you to be very careful about going outside. We have on our screen again the numbers that Soha gave us. We have 9,241 cases. As of today, we have 5 deaths, raising the death toll to 131. Across the world, we have numbers surging there as well, as you can see on our screen. Now, we have news that the briefing is going to start right now. We'll get back to you after the briefing.
Let us now begin our regular briefing for March 26th, Thursday, on the coronavirus outbreak here in South Korea. The total number of confirmed cases stands at 9,241. Of them, 4,144 have been discharged following full recovery. And of the confirmed cases, 284 were imported cases, 31 of them were foreigners, and the rest were Korean nationals coming back home. And the confirmed cases risen by 104, and the discharged people increased by 414 throughout the past 24 hours. And we could say that about 53.7% of the total patients have been discharged. The death toll has increased by 1 more and now stands at 132. And by region, Daegu saw the biggest increase and the biggest and largest number of confirmed cases, followed by Seoul and the metropolitan area. And 30 new cases were reported at the airport quarantine. 82.2% were related to cluster infections. And while the the breakdown of the outbreak is as follows. In Siheung City, one teacher of a daycare center has been confirmed, and we conducted 48 testings at this daycare center, and they have been tested negative. And in Gyeonggi-do province, we have completed our enumeration testings, and about 0.1% of the 300,000 was tested positive. And at a mental hospital, we confirmed 1 positive case. And at this specific center, we are currently carrying out investigation. And in Daegu, in Donggu, there is a hospital called Patima Hospital, and 19 confirmed cases have been reported. And therefore, we have been conducting a cohort quarantine on 1 ward of this hospital. And in light of the increase, the rapid increase of the number of imported cases, we saw that 39 cases have been reported out of the newly increased cases. Europe topped the list, and 34 were Korean nationals, and the rest were identified. A total of 9 people were identified later throughout the social spread. And starting from earlier this week, we have intensified the screenings for all inbound travelers from Europe. And from tomorrow, we also will have a stronger screening process for travelers from the U.S. All symptomatic persons entering from the U.S., regardless of nationality, will be required to have tested at the airport. If they are tested positive, they will be transferred to a hospital or life treatment center. And if they're tested negative, they will enter self-quarantine at homes for 14 days. And Korean nationals and foreigners with a domestic residence who are asymptomatic, they will be self-quarantined at their homes for 14 days and will be tested if symptoms occur. And as for the foreigners who are on short-term visit without domestic residence, they will be tested at a temporary facility. And if they are tested negative, they will be allowed entry into the country under enhanced active monitoring. Going forward, we will also closely monitor the outbreak trend that is unveiling in the U.S. And if needed, we will carry out a full-fledged screening. And for those of you who are on self-quarantine, we will be mandating all of them to download a mobile application, and utilizing the GPS, we will also monitor whether they are perfectly on self-quarantine. And we urge those who are coming in from elsewhere, for those of you coming in from Europe and US, please do participate in the strengthening measures that are put forth by the government. And for those of you who are coming from elsewhere, we advise you to stay home for the next 2 weeks. And in order to prevent family contraction of the virus, we urge you to wash your hands thoroughly and keep your personal hygiene. And for employers, we also advise you to advise the employees who have been returning from international businesses to not come to work for the following 2 weeks. And the KCDC also stresses, and we will stress the cooperation with related ministries to enhance the contact tracing of the virus. This will be fully operated from today. This system enables the analysis, a real-time analysis of the big data, and we will automatically identify the locations of the movements of the confirmed cases, so that we can identify who were actually at that specific spots. And the KCDC also would like to deal with the global outbreak, and we have urged the country to enhance and participate in the enhanced social distancing campaign until April 5th. We ask all of their citizens to stay at home as much as possible, other than for going to work, visiting a healthcare provider, and purchasing necessities. Also, working citizens are advised to maintain a distance from each other during lunch breaks, refrain from using break rooms and other social venues. And please do wash your hands thoroughly. That's all from me. Thank you very much.
Now, that was the Central Disaster and Safety Countermeasure Headquarters on the latest facts and figures of COVID-19. 104 new cases have been recorded as of early Thursday here in Korea, raising the total to 9,241. Among the new cases, 30 were identified at the airport, and accordingly, the government has stressed yet again the importance of the 14-day self-isolation of arrivals from abroad. There's also been a stronger call against non-essential outings as well as gatherings. Elsewhere, U.S. President Donald Trump has requested medical equipment from South Korea to counter the COVID-19 outbreak in the U.S. And this request speaks volumes about how fast the virus is spreading there. In fact, according to the World Health Organization, the U.S. could become the new center of the global COVID-19 pandemic. For more on the grim outlook, we have Gavin Yami, director of the Center for Policy Impact and Global Health at Duke University. Welcome, Dr. Yami. Now, the U.S. has seen significant surge in COVID-19 cases in recent days. As a health expert, why do you suppose this is the case?
Yes, we have seen a very rapid rise, and a number of areas have been particularly affected: Washington State, New York State, and now California. New York State very much the epicenter, particularly New York City. We are seeing a doubling of new cases roughly every 3 days. And most of that is driven by community transmission within the country. In fact, in recent days, unfortunately, and totally understandably, many people have fled New York City. They have gone to Florida or elsewhere to get away from the epicenter. But unfortunately, that is likely to lead to additional outbreaks elsewhere, since some of those people will already be carrying the virus that causes COVID-19. Most of the transmission is community transmission, which is one of the reasons why banning travel is really so useless at this point.
And yet a growing number of states in the U.S. are calling on their residents to stay indoors. And roughly 1 in every 4 Americans, I understand, are staying at home. I believe you're coming to us from North Carolina. How is the situation there like?
So that's right. Around a quarter to a fifth, something like that, of Americans are now in states where they have what's called a rest in place or shelter in place order, including California and New York. Right now, where I live in Durham, North Carolina. It is part of what's called the Research Triangle, which has a number of universities. The universities are all shut down. I'm a professor at Duke University that is essentially on lockdown. And we are following essentially federal guidance to stay at home, to keep at least 6 feet or 2 meters away from other people, to avoid gatherings. However, our state has not officially issued a shelter-in-place mandate, although in the last few days there has been a lot of discussion about when or whether the Governor Roy Cooper, will issue one. So we are expecting that order to come shortly.
Professor, you wrote in Time magazine that the U.S. needs to follow South Korea's model for fighting COVID-19. What did you take away most from our government's response to the COVID-19 situation?
Yes, that's right. About a week ago, just over a week ago, in Time magazine, I wrote a piece in which I wondered whether USA could follow South Korea's model and try and avoid the kind of catastrophe we have seen in Italy. And really, I think that there were 4 or 5 key things that South Korea did well. Don't forget, South Korea was heavily affected. It did have a very severe outbreak at the beginning. With a peak, I think, of about 900 or so, 909 new cases in one day. But it then flattened the curve, and it brought the number of cases down very sharply. Now, you did this, number one, through being very, very assertive and aggressive about testing and contact tracing and isolating those with the infection. We did not do that in the United States. The United Kingdom did not do that. I think that was a mistake. In some parts of the United States, it's too late now. The outbreak is too far advanced. But I would say that in other parts of the United States that have far fewer cases, there is still enormous value in trying to identify who has the infection, to isolate them, and to do contact tracing. The other reason why mass-free testing is so important is that it allows the public health community to figure out where the infection is, where are the hotspots, where are the family clusters, and it also helps us to protect health workers. Unfortunately, in many parts of America today, health workers can't even get a test. So number one, I would say, absolutely, is testing. In South Korea, used drive-through testing, as you know, 50 or so centers. It had hundreds of dedicated testing centers. On contact tracing, South Korea used modern information and communication technologies like GPS information from cell phones or cars. Now, obviously, there is a balance at play, and here in the United States, I think there would be less willingness to allow GPS data to be shared. But what South Korea does show is that if you aggressively identify and do contact tracing, warning people that someone with an infection has come to your area, for example, you can really help to get on top of the epidemic. Second thing is communication of data. I think your leadership was very good about informing the public about the situation and being very science-based. The third thing that I think is important, not just from South Korea's experience, but from the experiences of places like Singapore, Hong Kong, and other countries in the region that managed to flatten the curve, is that you need to have very good communication between departments and between the national government and the regions so that everybody is on the same page. We really suffer from that in the United States, where there isn't great communication between the federal government and the states. Daily briefings, for example, in Singapore between the federal government and regional district managers and hospital managers. So I think that's the third thing. Protecting health workers with protective equipment is critical, and then being ready, expecting there to be a rise in cases. And I think of all the places where the United States fell short, it was we had time. We knew that this outbreak was coming, and we didn't use that time wisely. South Korea, I believe, ran a simulation at the end of last year. I mean, that was lucky. They had already practiced what to do if an outbreak happened. And when they saw things getting out of control, they acted very quickly, knowing things were going to get worse.
Right. Countries around the world right now are on high alert for new COVID-19 cases. I mean, including Korea. Half of our new cases today were from overseas. How could we deal with this possible infections from those traveling into the country from outside?
Yes, I mean, the first thing to say is most transmission is community transmission within a country. Most cases are not imported. Travel bans don't work. They're not recommended by international health agencies, including the WHO, the World Health Organization, and they don't respect human rights. So I do not support travel bans. I think it is reasonable, as many countries have done, for example, China, to ask all new arrivals to isolate themselves for 2 weeks. So, for example, if you fly into China today or tomorrow, you will be expected to be in isolation for 2 weeks. That, to me, seems like a reasonable way forward. One thing that South Korea did well during the peak of its outbreak was that it asked new arriving travelers to download an app to monitor symptoms and let authorities know if they had symptoms. I think that's a very good example of South Korea using modern technologies to help control the outbreak.
Right. Thank you, Dr. Yami, for your time. Let's sincerely hope that the US is able to flatten its curve in the near future.
That's heartbreaking. The pandemic is accelerating.
With the worldwide spread of COVID-19, the infection has become a threat affecting not just healthcare systems and the economy, but also national security. And while individual countries need to take action at national level, a coordinated global response is critical at this stage. To delve into how the international community should work together, we have with us experts from the academic field to share their views. We have Professor Paul Tonks from Yonsei University and Professor Park Won-gon from Handong Global University on my left. Welcome. First, Professor Tonks, what is the situation like in your home country? I understand Prince Charles has just tested positive for the coronavirus.
That's right. The situation in the UK is obviously very serious. I think we've seen a huge ramping up of measures in the UK. Essentially, in a nutshell, we have moved from a policy of mitigation to a policy of active suppression and intervention. And I think what's very encouraging, although there have been some criticisms perhaps for a degree of lateness of the response, I think the government has now taken very seriously the latest medical and scientific advice. As some of your viewers may know, perhaps a little bit over a week or so ago, there was a very concerning report from experts at Imperial College London about the rate of infection, and they did statistical modelling of essentially non-interventions, limited mitigation response and active suppression. And so now we have seen, as you correctly said, I think a really unprecedented response of the UK government. Essentially, the country is in lockdown. Parliament has passed emergency legislation and has now suspended sitting for at least a month. And so I think the encouraging part is that we are seeing a response guided by clear scientific evidence and the best advice I think that the government is actively responding to. But clearly, these kinds of measures, these kinds of restrictions are something that, historically speaking, have never existed in peacetime.
Right. Professor Tonks, do you believe that the spread, the quick spread in Europe is owing to the European Union being a political and economic community where travelers, well, citizens of member states can actually travel across borders very freely?
Certainly, I think perhaps in the very earlier stages, obviously, as many experts have talked about, the movement of people as a result of globalization. Obviously, the EU has been one of the most integrated communities in terms of allowing free movement of people. I think that's probably true at the earliest stage. However, what we've really seen, I think the key phenomenon of the last few weeks is active restrictions, active policy interventions. The Schengen Agreement, which basically allowed open borders within the EU, has been really suspended, and individual governments, Italy, Spain, France, Germany, as well as obviously the UK, as we discussed before, are moving to impose really quite drastic restrictions in the interests of this public health emergency, and hopefully flattening the curve and mitigating the worst aspects by really strongly imposing restrictions. But I think as we heard earlier from our colleague in Duke in the United States, hopefully explaining, successfully communicating to the public the need to really take seriously and follow these best guidelines and measures.
Professor Park, we mentioned this earlier on in the program. The leaders of the G20 nations are holding a video summit today. This was proposed by President Moon Jae-in. What do you expect from this summit?
Well, I think this is a very important conference, although it seems to me it's a little bit late. Well, we can compare it to this coronavirus situation with Ebola in year 2014. At that time, WHO and the United States, actually, they led the international cooperation very actively. But we are seeing this kind of international cooperation. Like a week ago, we have a G7 meeting, but it turned out that there is no practical measure at this very immediately we can implement. And so that's why I have some high expectation that G20 at least kind of give a momentum to have a little bit late, but we have this international cooperation.
Travel restrictions are being recommended by countries. Yet again, these restrictions are hurting small businesses, which is why President Moon Jae-in is going to ask his counterparts to perhaps ease travel restrictions for people traveling abroad for business. What do you think of this proposal?
I think this is a very important proposal, especially for South Korea. We are heavily dependent on the export market. Our economies consist of around more than 80% of the export dependent. But at this very moment, we have the hurt very hard, not only South Korea, but all over the world. But we are especially hurt a lot because of this coronavirus. So that's why our president suggested this kind of travel for these business people who have this kind of certification, have this negative. But still, this is not that easy issue because all the countries, most of the countries have whether they put the emphasis on the economy or their people's the security and people's health. So it's not going to be an easy kind of a solution or the agreement to get from these other countries.
Meanwhile, the US and China have sparred over the origin of COVID-19, with US President Donald Trump calling it the Chinese virus, and China, for its part, claiming that the virus was brought into its country by the US Army. How do you regard this?
I think, unfortunately, in some regards, we're seeking to look here, I hope, at some of the positives that we can implement with active cooperation, international organizations. As my colleague Professor Park said, perhaps this G20 summit allows that opportunity. But I think at the same time, really what we're seeing in some ways is this crisis being an opportunity to vie for global leadership, influence, power. And I think in some ways, China, ironically, sees this as an opportunity really in some ways to challenge US leadership. As Professor Park was saying a moment ago, perhaps up until pretty much the current era, we've always looked to the US for leadership in the international sphere to play a leading role, to support medical interventions and provide, I guess, what one might call global public goods. I think at the moment we're seeing the Chinese, for example, we were talking about the situation in the EU. China's been sending medical teams to Italy. It's been seizing the opportunity, I think. If one wanted to look at this as genuine gestures of goodwill and learning lessons, I think that's probably a constructive and helpful way to look at it. And if one's perhaps being a little bit more cynical, one might have some anxiety about contests for power and influence at a time when really we should be cooperating in everybody's best interest.
Professor Park, how do you regard this finger pointing?
Well, actually, I agree with Professor Tang's argument, and it's very unfortunate. These two great powers, if they would cooperate in early stage, I think we can very effectively prevent the spread of this very novel virus. But unfortunately, they haven't. I mean, not just haven't, but they have a very serious competition. For example, like January 31st, this Secretary of Wilbur Ross, and he mentioned that this is a good opportunity actually for the U.S. economy. They can create jobs because of this very seriousness of the coronavirus in China. Even he mentioned that it is time to have an upper hand for the Americans to competition against the Chinese hegemony competition. And then after slowing down this Chinese coronavirus, they are arguing very strange things. They are saying that this is not the start at the Wuhan, China, and they accuse the United States we just mentioned. But everybody knows this coming from the China, and every expert point out that one too. So I think this is all those things, a very unproductive kind of accusation each other. Important thing is that, go back to the original argument, if they would agree to have a cooperation, still they can do. I mean, if they agree to have this kind of cooperation, they can coordinate research. We are very urgent to have some kind of vaccine. But to the superpowers, great countries, they have an ability and also tremendous of data from China and also very high technology from the United States. If they combine together, very short period of time, I hope they can get some kind of vaccine. Also about these suppliers, the PPE and the personal protection equipment, and ventilator and those kind of things, and face mask. Also, China can provide for the United States. So those are there are various other areas that they can cooperate each other, but at this very moment, they are just busy to point out with each other.
Right, unfortunately, right. Regardless of that, though, there are other areas in which other countries who are trying to make most of this, including, for example, President Trump expressing his will to help North Korea fight its virus. And do you see this as a silver lining for Pyongyang? I mean, nuclear talks were stalled for quite a while.
I think North Korea may well actually view it in that light. Pyongyang may see, again, a kind of opportunity to make something out of this crisis. So it may well see, in a sense, the challenges as an opportunity to consolidate its position vis-a-vis the US and the broader international community. Obviously, one would have to add the key caveat here, which I think a lot of people have anxiety, perhaps especially here in South Korea, that we need to avoid a major epidemic in North Korea in a place that clearly does not have the public health infrastructure, the kind of equipment that Professor Park was mentioning. It already has huge challenges with things like TB. From all that we hear from international organizations and NGOs that have been working in North Korea despite all the restrictions and sanctions and so forth, clearly there are going to be major health challenges. Lessons that we would know from other crises are that in countries that have problems with malnutrition, they will obviously have problems with diminished immunity. So in many ways, North Korea could really face immense problems. I guess on the flip side, one hopes that it could be an opportunity for active cooperation to mitigate those kind of risks and to deal with the tremendous potential public health problems.
Iranian President Hassan Rouhani also reportedly sent a letter to President Moon Jae-in asking for assistance in dealing with the COVID-19 pandemic. Do you see this gesture, or perhaps Korea's assistance to Iran, as easing ties between the two countries, which were strained given US sanctions against Iran?
Well, I think this is important for the humanitarian purpose, not just Iran, but we just talk about the North Korea. Although North Korea is officially denied, there is no confirmed case at all, but everybody, including the WHO, even the United States government, and even South Korean government, we are kind of pretty sure that there could be spread this coronavirus in the north. But as Professor Tonks mentioned, that they have simply no way to deal with this one. So it's pretty much unguarded people of it, the North Korean people. So definitely we need to help them for the humanitarian purpose. If they let them spread this coronavirus, it's going to be a humanitarian disaster. So it's very important to help to cooperate among the special international community. And back to the Iranian case, and it is allegedly known that Iran asked us to 3.2 million the diagnostic test kits. And I think Iran definitely needs these kind of things because they are also under the very serious economic sanction imposed by United States. Simply, they do not have any medicine, those kind of equipment at this moment. So it's also, again, it's very important to help them for the humanitarian purpose.
Right. Now, aside from countries, let's talk about entities, Professor Tonks. There are concerns that the World Health Organization is not doing its job properly, and also missing from this picture, of course, is the United Nations. It's supposed to be committed to international interaction. What are your thoughts on this?
We talked at the beginning, I think, about the importance of openness, movement, globalization, taking the EU case. I think in many regards, and perhaps one of the most unfortunate aspects of the current COVID crisis is, in a sense, a turning back or turning inward to national restrictions and a kind of lack of a breakdown of international community and cooperation in the way that I think is necessary. Because even imposing the kinds of restrictions that we have seen, the reality is the degree of interpenetration that we have in the current globalized world requires that kind of cooperation. I think there are legitimate queries and concerns about some structural and systemic challenges or even failings in some of those kinds of organizations like WHO. But probably this is the time to address constructively what are the resources, what are the funding, what are the kinds of policies that we can help support. As I said, I think there's been a kind of turning back inward on kind of national governments, and to some extent that's understandable and necessary. I think that there are obviously unfortunate competitions playing out that we've seen. The role of the permanent 5 members of the UN Security Council, I think, means that it's quite difficult to get that cooperation. For example, the US not necessarily agreeing with China, somewhere like Russia, as we know, in a sense, President Putin seems to be seeing this as an opportunity to further consolidate his grip on Russia, to consolidate authoritarian leadership and control, and kind of playing down the threat and crisis. And I think that that's something that hopefully can be shifted in the coming weeks and months ahead.
Right, we'll keep our fingers crossed for that.
If I may,
yes,
I want to just
Professor.
add about this rule of the WHO. I'm just very disappointed at this moment. You see, Professor Hanks is a historian, so he's far better know than me. But the reason that we establish United Nations and this multilateral institution is just to get the cooperation among the states, because nation states, they pursue their very tangibly narrow national interests. So that's why we built this kind of multilateral institution, and to impose a little bit, to restrict their sovereignty, and then they wanted to pursue the common good for the humankind. But WHO, this time, we pretty much already know that this director of Gov'T is pretty much supported by when they elected as director, got the support from China. And after this breakout from the Wuhan, and he's not the objective at all. He's very subjective to support Chinese position and Chinese government. Even he met President Xi Jinping, and he praised what China was doing at that moment, and even though they are spread out thousands of the people. So that's why we are losing confidence on this WHO and the multilateral institution. It's going to be a very huge negative impact in coming years. So that's why we have to revisit after slowing down and coming down all the pandemic issues.
Right, that is true. Well, yes, Professor Park Won-gon and Professor Paul Tongs, thank you for being here with us today. On that note, we end today's special coverage of COVID-19 pandemic. We come to you live on a daily basis at this hour, so do tune in. Arirang TV welcomes messages, feedback and questions from our viewers on the COVID-19 outbreak here. So be sure to check out our homepage at arirang.com or follow us on our social media accounts down below. As always, thank you for watching.